Hi guys, my name is Mishti. I'm the person behind Dr. What Is That? And I'm excited to share that we finally have our first guest speaker talking about what kind of rare disease they have. In a minute, I'm going to show you a clip of Harper Hifko. She's currently a high schooler, and she just wanted to share a little bit about celiac disease, which is a disease that she has. So, thank you. All right, so I'm here with Harper. Do you want to share a little bit about your experience with celiac disease? Just like a little introduction about what it is.
So I have celiac disease. It's an autoimmune disease that affects the small intestine. So I can't process gluten, which is primarily wheat, barley, and rye. It's mainly found in bread, pasta, different desserts. And basically, what happens is if I were to ingest it, it would affect the lining of my small intestine. So normally the microvilli of your small intestine are like this. So say I were to eat a piece of gluten, they would go like this and I wouldn't be able to absorb it because like it's like this so it has more surface area so you can absorb more nutrients and obviously that's not what would happen if I were to eat it, so it would really mess me up.
All right, thank you for the little introduction. I'm just going to
Mhm.
ask you a few questions about like the diagnosis of when you first had celiac disease and then also like your early experiences. So,
Mhm.
can you walk us through like the journey of getting diagnosed with celiac disease?
So before I got diagnosed, I was getting sick like all the time. I was always nauseous. I always wanted to throw up, and it would happen like every time I ate. And growing up, it would be sporadic. Like sometimes I would eat something and I wouldn't feel good, but then I'd eat again and I'd feel fine. So it was really hit or miss. But then freshman year, Thanksgiving, I got either the flu or COVID. And every time I ate after that, I would always get sick. And finally, it was about, I want to say January or February. After November, I had stopped running cross country. I didn't do track freshman year. And I had lost like 40 pounds in 2, 3 months. And I was like, something's not right. I'm not doing any exercise, but I'm losing all of this weight. So I told my mom, I was like, I need to go to the doctor. And so I did a different blood tests to see like if they could find anything. And then they also thought it could have been reflux. So I had to go on reflux medication. And finally, my blood test came back, and my like a normal celiac blood test would be around like 1 to 4. Mine was like off the charts. So they were like, you probably have celiac, but you have to get an endoscopy to like confirm it. And basically, what that is they put you to sleep and they go in through your mouth and they went all the way, they took samples from my esophagus, my stomach, and my small intestine to biopsy. And just to kind of confirm that I had celiac. And yeah, that's basically it. So that kind of confirmed it. And that's, you can take a blood test, but that's not always going to be what it, like, what confirms it. You have to get an endoscopy to confirm that you have celiac.
Hmm. When you were first kind of like misdiagnosed with like acid reflux, how long did it take between like then and actually getting diagnosed with celiac disease? Like, was it a while before they figured it out?
So I got diagnosed like early March, and I want to say I went to the doctor mid February. So, like, in between the blood tests and the endoscopy, I was on the reflux medication because they didn't want to chance it until like I got a confirmed diagnosis. And for me, the reflux didn't help. So they were kind of like, just take all, like, I think I took it once a day in the morning before I ate breakfast or anything. And then I would just take it until I ran out of the medication they gave me, and they were like, we just won't give you another prescription if this isn't what's helping you.
Okay, I see. Um, Thank you for sharing a little bit about the diagnosis and early experiences. I'm going to talk a little bit about like questions about like your daily life and like food adjustments. So, what were the biggest changes that you had to make after your diagnosis?
Um, well, obviously diet was a really big thing because I had to completely cut out gluten. And so the hardest thing for me was they didn't give me like a nutritionist after I got diagnosed, so I had to kind of figure everything out on my own.
Hmm.
And so it was a lot of research on what was gluten free, what is gluten, what do I have to look out for in an ingredient, because maybe something isn't certified gluten free, but it is gluten free because it just doesn't have any wheat, barley, or rye. And so, like, the most surprising thing I would say that has gluten in it is probably dressings and sauces. Like, soy sauce is a big one.
That's interesting.
And yeah, because when you think gluten, you don't really think, like, oh, does this sauce have it?
Hmm.
And and another thing is like different chips have it because of the powder. Like Doritos have like special like powder they use for
Hmm.
their cheese so that it makes it not gluten free. But Cool Ranch Doritos are, but like the normal cheese ones aren't. And then sometimes different ice creams will have it because they'll have malt flavoring.
Oh, okay.
So, like, that's something I didn't realize having malt in it would make it not gluten free, but evidently it's in there. So, I really have to, like, I triple check when I'm getting something gluten free. And that's made me more, like, conscious about, like, what brands I use, what grocery stores I go to, what restaurants I go to. And something that I think was really helpful is I actually have an app called Find Me Gluten Free, and it'll just like tell me different restaurants in the area, and I can see what places have gluten free options. And like sometimes I still need to do more research on it because I just see other people's suggestions, and not every restaurant that is gluten free is on there. So it's like I still have to do some more research, but it's definitely a helpful tool, especially when I was just starting out because like I didn't know anywhere I could eat, and now I have all of these options. But definitely the hardest thing was having to take out things that I had been eating for 15 years of my life. I had to
Hmm.
completely take them out, but like that's a lot of fast food restaurants just because cross contamination is a big thing too.
Right.
So say french fries are fried in the same fryer as like a chicken nugget that's fried, and then that makes like the fries, even though they're gluten free,
Hmm.
they now have been cross contaminated, so I can't eat them. And I'd say my favorite thing is probably Chick-fil-A because it's something that I was able to eat before and I can still eat it after. Like I can't have the fried like tenders or nuggets, but I can have the grilled chicken nuggets. So it's kind of like that was nice to have a constant to be able to eat.
When you go out to eat, or like even if you're like prepping a meal at home, what's your like go-to meal to make?
Um so I really like Mexican food because
Hmm.
a lot of their like tortillas or chips are corn based, so they don't really have any like wheat in it. And so that's really nice because again, like that's something I was able to eat before and that I can still eat after. And so I eat like a bodybuilder. Honestly, I eat a lot of grilled chicken and rice
Okay,
because
protein.
eeks, it's good for running. Gotta keep the
Uh,
gains.
so when you do accidentally consume gluten, what does it feel like? Like what kind of processes do you go through?
So it really depends, like what type it is. Like if it's like a cross contamination versus like an actual like, oh, I just had like a crumb of something.
Hmm.
Because it only takes like the smallest crumb to like upset my digestive system. So like if I were to get cross contaminated, I'd probably just feel like really nauseous and I wouldn't really know what's going on. But then, like, if I know that I've eaten something that's not gluten free, I will feel nauseous. I'll get like bloated. I'll have to go to the bathroom. Like,
Mm-hmm.
it's like a whole thing. And then every time I eat gluten, it raises my risk of having different cancers, especially in my colon and different like digestive tract cancers. So that's really like scary, as well as I can also develop different autoimmune diseases based on celiac, because
Mm-hmm.
once your immune system is already messed up, it is open for everything, especially like if you keep hurting yourself by ingesting gluten, your body's just more susceptible to creating another thing.
I see.
Mm-hmm.
I'm going to move on to some questions about kind of like your social life with celiac disease. So, has celiac disease affected your ability to like attend social events?
Um, well, for me, I have really good friends. So, like, if I go to like a party or something, like a birthday party, my one friend who always throws different parties, her mom is really good about always having something that's gluten free for me.
Mm-hmm.
And I will say, like, it's hard being able to like go somewhere and not be able to eat somewhere because they don't have any gluten free options. So, like, social settings where it's like not for me specifically, like I don't expect people to cater towards me,
Mm-hmm.
but it's just a little disappointing every time I go somewhere where I can't eat, just because I'm like, it's disappointing because I know I'm
Yeah.
not like everyone else.
When these instances do arise, like let's say you're like in a group setting and you're at a restaurant and you can't really eat the things on the menu, do you ever feel like you have to educate other people about your conditions? And like, yeah.
Yeah, I would say I do. I'm pretty good about telling people right when I meet them.
Mm-hmm.
And again, like I said, my friends usually let me pick somewhere we get to eat, but there's always that case where I can't eat or can't eat something at somewhere. And so it's kind of just disappointing. And people are always like, some people have said to me, "Oh, well, why don't you just eat it? It's not going to hurt you."
Mm-hmm.
But I really do have to educate different people on what actually would happen. And like every time someone says those jokes, I know it's a joke, but it's still like, you're telling me you want me to have cancer in my
Yeah.
mind. So it's like, it's hard to like set that aside, even though I know sometimes people are just joking.
Right. Have you ever found support from like the celiac community, either online or in person, or do you mainly just like rely on kind of like your family relationships and your friendships?
Um, I think, well, anyone who is gluten free knows that like people are usually really good about it.
Mm-hmm.
And there's a lot of different like, there's like I said, I have the app that tells me different gluten-free restaurants, and then there's a lot of like Instagram profiles where it's like I followed this specific one, especially because we go to NCSSM, so it's like moving to college, where it's
Mm-hmm.
called College Celiac, and they tell you like different groceries that you maybe want to get that are easy to cook in like a dorm style, or like a snack that's easy to grab when you're on the go, like say if you have to go to a class. So that's been really helpful. And just like there's different accounts where it just tells you about celiac, and that's really nice.
I see. Um, Thank you. We're gonna move on to some travel questions. So,
Yep.
um, how do you handle traveling, especially in places where you know that like gluten-free options may not be available?
Um I don't really
Sorry,
I don't
this
really
goes.
travel that much. I, okay. I don't really travel that much to places where I don't know they have gluten-free options. I do like prior research, but there's always like say I go somewhere I'm not familiar with, I'll always have to do a little bit more than like the average person just to like make sure that I can eat. And like I know New Zealand and Italy are both really good about celiac and being gluten free.
Mm-hmm.
And my dad actually went to New Zealand this last month, and so he was like looking out and showing me all the different gluten-free things. So that was like really nice to be able to know that like if I were to go abroad, these places are accessible and like gluten-free people are everywhere, not just like me.
Mm-hmm. Um, Besides kind of searching up the restaurants or like the food beforehand, do you have any other strategies for finding safe foods while traveling or at airports? Like kind of like just on the go if you don't research beforehand.
Well, fruit is always like a good, like one of my go-tos.
Mm-hmm.
I love fruit because I know it's always going to be gluten-free. And there's some brands that I just know are gluten-free, like certain chips, like corn chips or Lay's potato chips, or mainly most potato chips are
Mm-hmm.
usually gluten-free. And then I can always check the ingredients list. And I just like most like brands of food are good about saying contains wheat, but I always do a little look over between all the ingredients to look out for like the major like wheat, barley, rye, malt flavoring, all
Mm-hmm.
those different things, just to have like a predecessor to if I see this word, I know it has gluten in it. So that's been pretty good. Like if I am at an airport, that's an easy thing to look out for.
I see. Um, Done with the travel questions. We're gonna get into some emotional and mental health questions. So if you don't really want to answer, that's completely fine. But
That's fine.
okay. The first one is, how did your diagnosis affect your mental health at the time?
Um, it was actually really hard on me
Mm-hmm.
just because I had to change so much of what I used to be able to eat. And say I just really wanted a piece of cake, I couldn't just like go to the grocery store and get
Mm-hmm.
a cake because I had to like make sure it was gluten free. I and usually grocery stores like let's say Lowe's, they don't have just gluten free cakes out there. You just have to buy a mix and make it rather than having a pre made one. And so that was really hard on me, just not being able to eat stuff that I wanted at the time. And then seeing like my mom or my brother or my dad eat something that I used to be able to eat and it like smells really good, but I
Mm-hmm.
can't even try it. I can only smell it. That was really hard on me. And so I would say like having to change, especially because I got diagnosed so late in my life where I knew what all of these like delicious foods tasted like, not being able to have them ever again, like really made me struggle because I missed being able to have just like an easy, if I want to eat this, I can. And I would say that's like also pretty like hard on me now still. Like I just really want like a cookie sometimes and I just can't have it. And
Mm-hmm.
that's what I think was the hardest thing for me, having to transition from being able to eat whatever I want to always having to look out for something or always having to worry like, oh, is this going to make me sick? So that would probably be the hardest thing that I would say.
Kind of tied to your response, do you ever experience kind of like food anxiety or like the fear of getting sick from cross contamination when you're eating from like restaurants or things like that?
So yeah, like I have really bad anxiety about like getting sick,
Mm-hmm.
and I've had this my whole life. Like I will admit I do not like vomit or throw up,
Yeah.
and I don't like feeling nauseous. So like that was definitely a struggle that led me to be diagnosed. Like I had to know if I was like okay or if I was always going to feel nauseous. And so once I started eating gluten free, I will definitely say it got better
Mm-hmm.
because I felt like this like relief that oh, if I eat gluten free, I'm no longer going to be sick. But now it's still better than it was before, but I would still say I have this anxiety, especially at new restaurants. that I've never been to before, or like there's not a lot of information on how like they treat their gluten-free food, I will say it's definitely something where it's like, oh, is this gonna make me sick?
Mm-hmm.
And so I always have like a little bit of anxiety when I'm going to a new place, but there's different things that I do. Like I ask waiters to make sure it's gluten-free. I ask them to change their gloves, or I ask them to prepare it on a different surface. Like, and that's like helps me calm my anxiety, I would say.
Mm-hmm.
And so yeah.
Has there been any kind of like method or technique to kind of ease your anxiety when you're feeling like you're gonna like have an anxiety attack or anything like that when thinking about getting new food?
um I kind of just push through it.
Mm-hmm.
Like I try to distract myself mainly because I know like not every place is gonna like make me sick. So I like, especially at places I've been to before, so it's nice to have like a distraction. Like I say, I'll go out to eat with my friends. Like I'll
Mm-hmm.
talk to my friends instead of worrying about, oh, is this gonna make me sick? Oh, is this gonna make me sick? Or I really like to play different like mind games like Sudoku or Tetris or like Block Blast, because it really like helps me distract myself. So that's like really nice.
Okay, thank you for answering kind of like the deeper questions. We're gonna move on to some lighter questions now. So, um,
Okay.
are there any advancements in celiac research that you're excited about or that you know of?
Um, I know there has been talk about a pill
Mhm.
to help with celiac disease, so maybe we wouldn't have to eat gluten free and maybe we could eat whatever we want. Um, I know it's like not tested right now. They're working on it, but like if that were to happen, that would be like really helpful because then I wouldn't always have to worry about where I'm eating or what I'm doing with my food. And so that would just be like a way to again ease the anxiety of what's going to happen to me if I eat this food.
Yeah. What do you wish that more doctors understood about like diagnosing and treating celiac disease with their patients?
I feel like I I wish they had given me like a support system when I got diagnosed, because jumping from, oh, you don't have to be gluten free to, oh, you're celiac, so you actually do. I
Yeah.
wish they would have given me that nutritionist or someone to talk to about like how this is dramatically going to change my life
Hmm.
forever, because I will have to be gluten free the rest of my life. Like, because it's an autoimmune disease, it's chronic. I'll never be able to like just enjoy whatever foods I want. They'll always have to be gluten free.
Hmm.
So I think if they were more helpful, I guess, setting up a support system, especially for newer celiacs who maybe got diagnosed later in life, like myself,
Hmm.
it would be really helpful for someone to help me along the way on changing my diet from what it was before.
Do they usually not give nutritionists when people are diagnosed with celiac disease, or was it just your case?
Um, I think it honestly depends.
Mm.
I I know a couple of other celiacs, and they weren't given a nutritionist either, but they were also diagnosed a lot earlier than me.
Hmm.
So I don't know if it's like different if you get diagnosed like when you're younger, but I will say like I haven't met anyone who was given a nutritionist. But even my pediatrician was really surprised that they didn't, like the hospital didn't give me a
Hmm.
nutritionist when they had my doctor like do the endoscopy. So I think more people would like to see that. But yeah.
All right, I see. What's like a really big misconception that people have about celiac disease?
A lot of people just think gluten is bread, cake, pasta. Like most people don't know what gluten actually is. So when I say, "Oh, I can't have that," and say it's like
Hmm.
a Dorito, they're like, "Why?" And so I
Mm.
think just like the education on what it actually is and like how it's gonna affect me. Like how I said earlier, where people are like, "Oh, just have a little bit, you'll be fine."
Hmm.
Because I've also been asked if I can microdose gluten. Like some people with allergies, like a peanut allergy, they'll have like a small piece of peanut and then they have their allergy go away. That's not the same as having the autoimmune disease because there
Hmm.
are some people with a gluten allergy rather than celiac. So maybe they could do that, but I couldn't. It would
Hmm.
only just ruin my small intestine.
All right. Are you ready for the last question?
Sure, hit me.
Okay. What advice would you give to someone newly diagnosed with celiac disease?
I would definitely say have a strong support like within your family or friends like who are going to be supportive of how much you're going to have to change like something that was so familiar to you like your diet, and definitely know that there's always places that have gluten-free things, and then there's always fruit. Always fruit. Fruit is about to be your best friend, and just having like different grocery stores, like you're gonna have to go to a lot of different grocery stores, but I would say Trader Joe's is like a like
Love Trader
really
Joe's.
big thing because they have so many different gluten-free options that
Hmm.
it's one of my favorites to get different things because they have so many options for me. And definitely breakfast is what's really hard, and
Hmm.
they have a lot of different muffins or like they have frozen pancakes, they have frozen waffles that are all gluten free, so that's really nice because it just gives you something to eat.
All right. I am done on my end, but is there anything else that you want to talk about?
Um, Let me think. I don't think so,
Okay.
but
Well,
yeah.
then, we're done. Thank you so much
Yay!
for letting me interview you, and thank you for sharing a little bit about your experience.
Of
Yeah,
course.